Hello, my name is Vicky and today I'll be talking about sweat glands. Please note that all references to principles of anatomy is from the second Asia Pacific edition in this presentation. Pseudoauriferous glands, also known as sweat glands, are split into two main types, eccrine and apocrine. Eccrine meaning that releases outwards, apocrine meaning separating from. According to the principles of anatomy and physiology, sweat glands are glands that have cells to discharge sweat through areas such as hair follicles or pores onto the exterior of the skin, and there are 3 to 4 million sweat glands in the body. Eccrine sweat glands are more common compared to apocrine sweat glands and are generally found in most areas of the body from skin. Examples of these areas are in the skin of the forehead, palms, and soles. Eccrine sweat glands are not found in areas such as lips, eardrums, and more. The principles of anatomy refers to the appearance of these eccrine sweat glands as simple coiled tubular glands. The discharge or secretion area of the gland is found in generally the dermis layer, but may also appear in the subcutaneous layer of the skin, which can be seen on the screen. Apocrine sweat glands are in the skin and eyelid. The secretion of these sweat glands usually have an odor. Looking to the screen, these glands are also in the form of coiled tubular glands, as described in the Principles of Anatomy. However, apocrine sweat glands possesses bigger ducts and lumens in comparison to eccrine sweat glands. The discharge or secretion area of this gland is found in the lower dermis or the upper subcutaneous layer of the skin. According to CancerGov, apocrine sweat glands can be found in locations such as in the armpits, the region surrounding the nipples of the breast, and the groin area. Once again, the two main types of sweat glands are eccrine and apocrine. Sweat glands helps in restoring damaging skin. One of the main functions of eccrine sweat glands is thermoregulation through evaporative heat loss, hence body temperature regulation. To further explain this, when the body temperature inside the body rises up, eccrine sweat glands discharge water to the surface of the skin. Another function is the removal of iron and nitrogenous waste. Lastly, eccrine sweat glands are triggered through emotional stress. The gland can make up to 500 to 750 meals a day. The start of the function begins soon after birth. A common function of apocrine and eccrine sweat glands is that they both stimulated in emotional stress. However, with apocrine sweat glands, they are also stimulated during sexual excitement. As mentioned earlier, these glands are associated with hair follicles in areas such as the groin. Although this gland may be a product rich in protein, the odor produced in the beginning is actually odorless. After the exposure of bacteria, the odor becomes present. The start of this function is during puberty. The question is, can I live without sweat glands? The answer is yes, although it depends which is removed or born without or abnormality function. Endoscopic thoracic symptothectomy is a treatment that is used after unresponsive effects of treating excessive sweating, such as facial sweating. It is quite common for people to remove axillary sweat gland for the underarm. People that sweat profusely underarm may seek a plastic surgeon to permanently remove the sweat gland. This can be done through the less invasive way called suction curettage or the more traditional surgical way. In order to do this, the surgeon tries to block out nerve signals and therefore certain nerves may be cut or destroyed. However, if a person has anhidrosis, meaning that there is an inability to sweat, may be a problem as well as it may affect the body temperature as the body cannot cool down. Therefore, conditions such as heat exhaustion, stroke, cramps can happen due to vigorous sport activities, for example. Therefore, the removal of an eccrine sweat gland that helps thermoregulation would not be ideal to the body. My future profession is to be a nurse. I believe that it should be basic knowledge for a nurse to have knowledge of how the body works, which obviously entails the anatomy and physiology of sweat glands. I believe that this strengthens a nurse's knowledge when a doctor is doing a procedure. It also makes it easier for the nurse to assist the doctor as they can predict the direction of the doctor's treatment to the patient. I believe that this is important for a nurse to know about integumentary system because it includes the skin factor, hence the importance of learning about sweat glands. For example, if a patient comes in with hypothermia and the body temperature is not dropping because the patient is not sweating, the nurse can have an approachable thought of the patient having a condition such as anhidrosis before the doctor confirms it. Nurses can then have a preparation mentality of what may be needed for the patient once the doctor confirms the nurse is ready to assist the doctor for treatment already. Thank you for listening. The next slide is the bibliography for this assignment.